Hi, my name is Lorna Dawson. I'm the health literacy specialist in the regional health literacy team. Welcome to this bite-sized session on Speaking Simply. So today I'm going to do a quick recap of what health literacy is, get you to think about when you speak to people, and then think about what makes it hard for people to remember the information that you say to them. And then share some tips on speaking simply and checking understanding. So first up, what is health literacy? There are lots of definitions of health literacy. This is just one. It's from the World Health Organization, and they say that health literacy is about being able to access, understand, check, and use information to make choices about health. So it's about being able to get hold of information in the first place from the internet or from a GP or a book in the library. It's about being able to understand that information, what the doctor's saying, or kind of the words on the page. Then it's being able to check whether that information is reliable, if it's trustworthy, if it's in date or applies to them. And then being able to use that information to make some sort of choice. And this could be the choice to have a life-changing operation, or it could be kind of what foods you want to put on your shopping list. So how many people are kind of affected by health literacy? So in the Northeast, it's estimated that about 62% of adults struggle to understand health information containing words and numbers. That's higher than the England average. So in England, it's about 58% of people. So that's about 2 out of every 3 people might struggle to understand something like a GP appointment letter or the timetable at the gym. So that is a massive amount of people that are affected by this. But actually, kind of that's a trick question because really everybody can be affected by low health literacy at some point in their lives. Health literacy levels aren't like a number that stays the same with you for life. They change depending on what's happening in your life. So you might have a degree, but if you're in a car crash, your ability to kind of take on information will be massively reduced because you'll be in shock. So the paramedic might be saying stuff, but it's going to be really hard for you to take any of it in. So bear in mind that kind of even though somebody might seem calm and like they're taking information on board, you don't know what's going on in the rest of their life. There might be other things affecting their ability to take on information. So one of the ways that people access information is by talking to people like you and me, or by us talking to them. So I just want to give you, like, put you in that mindset of when you talk to patients and the public, to put you in that scenario. So you might talk to patients in the public and explain how to take medicines. You might explain people's rights. You might give them directions, tell them how to get to a certain department. You might need to ask questions to see if they meet certain criteria, if they're eligible for something. You might need to explain things, people's options. So it might be treatment options to get informed consent. In an appointment, you might need to ask questions to find out what's wrong. You might need to give appointment details. And also, I'm sure a lot of us talk a lot in meetings. And it's not just about kind of patients and the people that we support. It's also about talking to the people that we work with who might not have the same background as us. So those are all kind of examples of when we talk to people in our jobs. So now I'm going to give you a bit of a flavour of what might make it hard for people to remember information in those situations, because there's lots going on that we don't necessarily see. So people might be feeling stressed, and that might make it difficult for them to like take on board what you're saying because they're thinking about something else. If the information is complicated, it's going to be really hard to take in if you don't understand the words. If the information's new, people might need things explaining slower, or they might take a bit longer, need to ask questions. If people don't write things down, they might forget them later on. People might have a health condition that makes it harder to concentrate or remember, so they might be in pain, which makes it really difficult to focus, or dementia will affect your short-term memory. If things are explained in kind of complicated language or medical jargon, they might hear what you're saying, but they might not understand it, so it'll be difficult to remember. They might be overwhelmed by the situation. What you're telling them might be coming as a shock, or even just being in the space, like a hospital space, for example, might be a bit too much for them. And it's taking all their willpower and brain power just to be sat there, never mind taking on new information. They might be distracted, the mind might be elsewhere, they might have a relative who's ill, might be thinking about whether they can afford the heating tonight. If information is poorly explained, it's going to be hard to remember. And some people might have different learning styles, so they might learn better by seeing things written down or diagrams rather than actually hearing information. I guess the point is there are lots of reasons why it might be difficult for people to remember all the information that we give them. I'm going to share some more statistics now. So it's really important to remember, like no matter what is going on in somebody's life, you're never going to know kind of what's affecting their ability to remember. But it's really important to remember that they are likely to forget some of what you've said. And actually it's more than you think. So if you think about 100% of what you say, people will only remember 20 to 60% of that. And of that kind of 20 to 60% that people remember, only 10 to 30% of that will actually be right. And bear in mind that the more information you give them at once, the more likely they're going to forget it. So it's really important to use kind of techniques that make it easier for people to take information on board in the first place. And then for you to kind of check what people remember and if it's right, so that if they don't remember it right, you get to explain it right again before they go. And it's also really important to give people a chance to ask about things that they may not have got the first time around. And what I'm going to do now is share tips on how you can do those things. So speaking simply and checking understanding. So as a team, we've developed a really useful acronym to help you remember the different techniques that you can use, and we call it Discuss It with Deborah. And Deborah is an acronym. It stands for Don't Assume, Use Everyday Words, Break It Down, Repeat It back, and Ask for questions. I'm just going to explain those letters a bit more. So first letter D, don't assume. So I think that sometimes we try to judge somebody's understanding or education level. So we have a bit of a kind of gauge whether somebody seems to be taken on board what we're saying or not, whether they seem to understand. But it's really important not to assume. So I'll go back to that trick question where I said that everyone can be affected by low health literacy. So we don't know what's going on in that person's life. They might be able to use kind of complicated words. They might nod along and look like they're understanding, but that doesn't actually mean they understand. A lot of people say they nod, they say, yep, I understand, to the professional, and they go home and they don't actually have a clue. So what we would say is kind of don't assume anybody's kind of health literacy level or understanding. Start with assuming that they don't know a lot. Speak simply, start with the basics and build up. People can always ask questions if they get it and they want to know more. Yeah, but really important not to assume kind of knowledge at the start, or somebody's reading level. E stands for everyday words. So by this we mean things like don't use jargon, or if you have to kind of explain what you're saying. Use words when you need to explain something, use words that you'd use to talk to a friend. And I've got a few examples of what those might look like. So instead of saying something like prognosis, you could say what's the outcome or what's your chance of recovery. Acute, say something like it comes on quickly or it happens quickly. Locate, find. Instead of saying abrasion, you could say like a cut or a graze. I don't think I've ever said abrasion to a friend. Instead of saying suture, say stitch. I don't know if I said that right. And instead of saying something like consolidation, you could say something like air in the lungs replaced with liquid. Sometimes you can change a word and make it shorter. Sometimes you might need to use a phrase. But the key is to use those everyday phrases that anyone would be able to understand. Sometimes you might want to use pictures or kind of flow charts, or diagrams to help you explain things, or you might want to use some examples to help. So don't necessarily just rely on words either, but when you do use words, try and make them as everyday and simple as possible. B is for break it down. Now, often in kind of appointments, we have to give a lot of information at once, and this can be really overwhelming. And I've got a picture to describe how we usually kind of share information with people. We tend to know that we've got to give a lot of information in a short time, and we give it all in one go, in one big, massive chunk. And then at the end, we say, have you got that? And the person we're speaking to will usually say, yeah, yeah, when really kind of they're just like, oh my gosh, that was a lot. I need time to process it. If you have a lot of information, we recommend that you break it down into small chunks. So on the right, we've got a picture of how it should look. So break it down into bite-sized chunks, and at the end of each chunk, just kind of check somebody's understanding, and you can check it as you go along, so that if somebody doesn't understand, you can explain it again in a different way. Because it's really frustrating when you get to the end and somebody didn't understand what you said right at the beginning. So kind of break it down and use simple words. So those everyday words that we talked about before. R is for repeat it back. So I'm just going to go back to that picture where we chunked the information up or broke the information down into chunks. And you might be able to see that there are little question marks. And these question marks are to kind of like check the person's understanding as you go along. But the important thing is that you are not, it shouldn't feel like a test for the other person. You are checking that you have explained well enough. It's our job as professionals to explain information in a way that's easy for people to understand. It should not feel like a memory test for the patient. And I've got some examples of the kind of questions that you can ask to check the patient's understanding. So again, kind of you're testing your ability to explain and communicate, not their understanding. You might want to say something like, I want to make sure I've explained things clearly. So tell me, what do you think are the 3 most important things to know about diabetes? Or kind of ask what they're going to do when they get home. So when you get home, if your partner asks what we talked about, how would you explain it to them? Or kind of, could you tell me or show me what you're going to do to take your medicine at home? And all of these questions check somebody's understanding. They'll check kind of what somebody's remembered and what they haven't. And it gives you a chance if they haven't kind of said something important, or if they kind of show you how they're going to take their medicine and they do it wrong, it gives you a chance to correct that before they go. A lot of the time, we'll give people information. We'll say, does that make sense? They'll go, yeah, they'll leave. And you won't actually know what they've understood and what they haven't when they left the door, or when they leave. So this, by kind of checking understanding, you'll know that when that person leaves, like what they've understood and what they're going to do. So it should give you more confidence. I would say these kind of questions feel really awkward and uncomfortable at the start, especially that kind of phrase like, I want to make sure I've explained things clearly. And it will still feel a bit like you are kind of testing the patient. We say repeat it back because we want to hear back the things that we have said to them. So yeah, and it can always be, I want to make sure I've explained things clearly, so can you just repeat back what we've talked about? Okay, so last letter. A is for ask for questions. Now, I've got some questions that we probably usually use after we've given people a lot of information. So we probably say things like, do you understand? Is that all clear? Does that make sense? And I would say with these kind of questions, people are going to say yes, even if they don't understand, because it's really hard to tell like a professional, no, actually, I don't understand. You haven't explained it clearly. Can you say it all again? You need to invite people to ask questions, and make it seem like you're expecting them. So make it seem normal that they should have questions at the end, instead of kind of these yes or no questions where really you kind of like, you want the answer to be yes because you want to kind of get on to the next person. So you can say things like, what questions do you have? Like, we've covered a lot today. What questions can I answer for you? Or you can explicitly say, I expect you have questions. What would you like to know more about? So these are very open, and they are definitely inviting and encouraging questions. So that is discuss it with Deborah. So D is for don't assume. E is for everyday words. B is for break it down. R, get them to repeat it back. And A, ask for questions. So those are our simple tips for speaking simply. Thank you very much for watching. If you've got questions or want to know more, feel free to drop us an email at stsft.nenchealthliteracy@nhs.net. Thank you.